the striking doctors, as we call them, reached a point when they were saying it is the government that is on strike. It's not us that are on strike. There was a point also that we witnessed the negotiating side of the government walking out. Because negotiations are negotiations. So long as the unions are here, negotiations must take place. Can we get an assurance that there will be no walking out until this is done from the minister? Secondly, the issue of risk allowance, Mr. Speaker, is something that has been on for many years. Why is it taking very long, and yet CRC was part of the All of Nation Approach Committee? Why wouldn't it have been discussed alongside that so that we don't have this delay? The problem, Mr. Speaker, is that people have died. And I think the minister knows that people have died. People are suffering as we are talking. People have had to go for very expensive alternatives. Why would we be dealing with an issue called risk allowance, which was done in the 90s? It was not even in the year 2000, it was before, when this idea of risk allowance, which was going on in other countries other than Kenya, were negotiated. Why would it not be done? So, finally,
Senator, just
two.
You've asked 2 questions.
Thank
That's
you.
more than enough. Senator Veronica Duarte.
Thank you, Mr. Speaker. And you have put to rest the points of order. Otherwise, I would have maybe advised my colleague, Senator Sifuna, on the meaning of common parlance of English language and how you cannot retract and then reinstate the statement in different words. Mr. Speaker, I will now go straight to the questions. I will go straight to the question to the Honorable CS. Once again, welcome to Senate. And as you very well know, healthcare remains a critical pillar to the welfare of our nation. And ideally, it should enjoy budgetary priority in resource allocation. So, Honorable Cabinet Secretary, Kenyans are very concerned about how prepared the ministry is in managing the transition from NHIF to SHIF without exposing and while avoiding any gaps that may expose the Kenyan population who require healthcare on a daily basis. And question number 2, so how prepared is the ministry in managing that transition? Number 2, you know, it is women who give birth. Linda Mama program seemed to have enjoyed a lot of popularity and is a program that was acclaimed and approved. Within the SHIF framework, the new framework, what is the ministry doing to design a specific program to Linda Mama, specifically that woman who is pregnant, for prenatal, labor and childbirth, and postnatal care without limiting those visits to 2 or 4, but to Linda Mama in as much as they require that postnatal care until the mother and the baby are both safe in the ministry and within the public hospitals that we have in Kenya.
The 3rd question will be asked by Senator Hamida Kibwana.
Thank you, Mr. Speaker. Madam CS, I've just been wondering, actually the morgues are full now. The patients are not being attended to. They're not attending to the patients and they are dying. Does the government realize that this is a matter of life and death? How long will this go on, seriously? So we should continue losing lives just for the government to have its own time to honor the CBA. I think, seriously, it pains. It really hurts. Number 2, we've also realized that maybe once the interns are back, the interns are sent to work in facilities unsupervised. Now, this is, of course, risky. Without any personal, whatever, professionals being around, I'm wondering, we are talking about deaths, we're talking about interns also who are unsupervised. I don't know how this issue is going to be tackled, but please, our people are dying, Madam CS. Kindly do something. Thank you.
CS.
Thank you, Honorable Speaker and honorable members. I'll begin from the question of Senator Professor Kamar, that the KMPDU has alluded to the government being on strike. And they have explained that this is because the CBA was not implemented from 2017 to date. Honorable Speaker and honorable members, the CBA that was signed had several aspects. And in my earlier submission, we have put those matters into the different areas that need to take responsibility. We have matters for the national government, we have matters that are cross-cutting, we have matters of county government. Speaker and honorable members, I want to confirm that of the 6 issues that pertain to the national government, we have addressed them. The issue of postgraduate fee arrears, that has been addressed with the release of 200 million from National Treasury for payment. The issue of basic salary arrears within the CBA. As for the doctors who work within the national government, that aspect has been met. And in fact, there is an overpayment. And now the government is asking, what do we do with the overpayment of the arrears to the doctors? The issue of CBA between KMPDU and Kenyatta National Hospital was waiting concurrence from Salary and Remuneration Commission. That has already been done. The issue of CBA between Moi Teaching Referral Hospital and KMPDU, that has already been finalized. It was a matter in court and a decision was already passed. The issue of CBA between Kenyatta University Teaching and Research Hospital and KMPDU, the CBA is now ready. Kenyatta University Teaching and Referral Hospital has called the unions to go and discuss and negotiate on the CBA. So, Honorable Speaker and honorable members, on matters pertaining to the national government, progress has been made. The only sticky issue is the stipend. And Honorable Speaker and honorable members, I want to ask of this House that as for that stipend, we are asking that if the interns, and should they accept that, then they open room for negotiation that government has offered. They have not come to the table to tell us that, no, we will not take that, we want this. That must be allowed to happen. Professor Kamar, on the issue of government walking out during the discussion, I was in that meeting, and I want to confirm that the government did not walk out. The meeting adjourned. Why did the meeting adjourn? Because we were following the orders of the judge from the court. And the judge ordered that the doctors should suspend the strike for negotiations to proceed. And that is what we were asking of the doctors. Suspend the strike, negotiations to proceed. And I want to confirm to the House that negotiations will be good. Negotiations will be done, in fact, accelerated if we have no people dying out of this strike. They will be accelerated if the doctors are at the bedside of the patients. The risk allowance, I want to clarify, on the issues raised by KMPDU, risk allowance does not arise. The people who raise the issue on risk allowance is the clinical officers. And they're saying they want the risk allowance to be enhanced from 3,000 shillings per month to 15,000 shillings per month. Honorable Speaker and honorable members, that is 500% increase in the risk allowance. That is an issue of budget. Once we get SRC guidelines, if that is possible, then we put it in the budget for consideration. And once the House, the National Assembly approves our budget, Exchequer is released, we shall be able to meet that. Because we know that whatever they are doing is risky, and indeed, they deserve risk allowance. So the issue is the movement from 3,000, 15,000, the 500% increase. If SRC confirms that that is in order, then we'll put measures in place for resources to be put together for that. The issue raised by Honorable Senator Veronica. Earlier, I have spoken about the transition from NHIF to Social Health Authority. As a ministry, we have done our best. And that is why we put together a transitional committee, a committee of experts to guide the process. And as I did reported earlier, there is a roadmap, and we meet after every 2 weeks, and we are satisfied with the progress that is going to be a smooth transition. And no patient should actually notice that there was a change. It should be a seamless transition. On the issue of Linda Mama, I want to confirm, as a mother myself, and probably aspiring to get another child, maternal health is of importance to me. So I will not be the one to preside over a situation where maternal health is not covered by this country. And I want to confirm that in the Social Health Authority, reproductive health has been covered under the benefit package. In fact, it is an expanded package from what was there under Linda Mama. So let's not be stuck on the name of Linda Mama. Let us be concerned about what is it that they were getting then and what is it that they are getting in the new one. And I confirm that is expanded and the benefits are expanded. On the question raised by Senator Hamida regarding the government and the ministry, whether we know the situation. Yes, Senator, we indeed know the situation. On a daily basis, we are tracking what the situation looks like. We have developed a tool that is being filled by the county governments. We have developed a tool that is being filled by the national referral hospitals, whom we have 100% control over. And for the weeks that the strike has progressed, I want to confirm that in our teaching and referral hospitals, Moi Teaching and Referral Hospitals has recorded the highest increase in the number of medical officers who have gone back to work based on the administrative measures that we have put in place. But also take responsibility that in Kenyatta, we have an issue because the registrars have not gone back to work. And registrars are people who are now doing their postgraduate training. We have government-sponsored and private-sponsored. Those are the people that we are talking to so that they can get back to work and be able to carry on with what they have been doing. So we do understand as a ministry the gravity of this matter. And that is why on a daily basis, nowadays, for the last 3 days, I think, we have been in meetings till midnight to find a solution to this issue. And as I have said, this solution will not just come from the Ministry of Health. It will come from the whole of nation approach and the ministry being able to implement what will have been agreed on. I have also said that we expect a ruling from the court today. The mention is happening today. But the judge in his wisdom already ordered the doctors to suspend the strike. I want to plead with the doctors that if they respect the court orders and suspend the strike, they will create a very good environment of being listened to, and even the government also moving forward so that we meet somewhere with the doctors. Regarding internship centers, I want to confirm that as a ministry, we have a criteria that is used to determine what centers become internship centers. There must be existence of specialists who will supervise the interns. There must be existence of equipment that the interns will use. There must be existence of commodities for the interns to use. And that's why we are saying we want to take time and ensure that this matter is resolved for once. Because we have 85 internship centers in the country. 65 of them are in public hospitals. So as a ministry, we have at least ensured that the commodity aspect is taken care of. The equipment aspect, we are working on it. And now, what was remaining is to ensure that there are specialists there, but to confirm that we have a number that should be able to supervise the internship. Speaker and honorable members, I would like to say as well that this is a shared function devolved. So the county governments have their responsibility to take, the governors to take in this matter. Where the union has raised specific issues with them, we expect that the governors should handle those issues. The issues that have been raised to the national government, I have confirmed to this House that indeed we have handled them. Speaker and honorable members, I submit. Thank you.
Thank you, CS. Senator George Mbugua. And please be very brief.
Okay, thank you, Honorable Speaker. Madam CS, I have a simple question to you. From where you sit, due to the importance and the complex nature of this sector, do you think it's time the country start a conversation of transferring the human resource of health from the county government and the creation of a health service commission so that we can have order in this sector? Thank you.
Senator Beatrice Ogola.
Thank you, Mr. Speaker, sir. My question, the first one is, Madam CS, what is the best of the USC staff whose contract ended, taking into consideration that as a nation we are looking at achieving universal health? On the strike, Mr. Speaker, sir, I want to say that negotiations need goodwill from both parties. Even the language we use when we are negotiating is very important. I realized the CS at some point was giving a statement that was kind of running away from the whole challenge. Like when you say only this number belong to the national government, it is like saying somebody else should be solving it. But the buck stops with you, and the buck stops with the head of state. I do not understand why, as a nation, it is so easy to give foreigners or other people good packages. I remember sometimes back when we were engaging the Cuban doctors,
Senator,
a lot was given to them.
get to your question, please.
Why is it difficult to attend to the doctors' need when we could give the Cuban doctors a lot of leeway?
Thank you, Senator.
You also said
Senator, you
that
can only ask
they
one
have
question.
not come to us.
Senator Beatrice.
Yes, Speaker.
You've asked two questions. Senator Beatrice. Thank you, Senator. Senator Mofire.
Thank you, Honorable Speaker. My question is on Marimanti Level 4 Hospital, which is in Tharaka-Nithi County. This is the only facility in the entire eastern part of Tharaka-Nithi County, which serves quite a number of catchments, including Ukambani, part of Ukambani. This hospital, Madam CS, lacks some very essential machines, including the CT scan, the renal unit equipment, and the mammogram. Honorable Madam CS, what is the ministry doing to make sure that this facility is equipped so that we can get people having services that are required, considering that this is the only facility? Currently, we are about to graduate, these facilities are about to graduate into a level 5 hospital, and quite a number of nurses are taking rotational courses there. What is your ministry doing to make sure that the Marimanti Hospital is being equipped with the necessary machines as required?
Thank you, Senator. CS, please respond.
Thank you, Honorable Speaker and honorable members. The question raised by Senator Mbugua, whether it is a high time for there to be a health commission. Honorable Speaker and honorable members, I take note that this is the House that is the defender of devolution. This is the House that is supposed to ring-fence and take care of devolved function. Having a health commission would be ideal, but that process would be outside the mandate of the Ministry of Health. It would be a constitutional question. So since the conversation is ongoing, and if everyone believes that then that is the direction to be taken, then we as a ministry are happy that then the process of having a health commission through a constitutional process is then started so that then that is achieved. On the issues raised by Senator Beatrice, I do understand your concern regarding the language of discussion. I take responsibility if I have sounded like I am not using the right language, but at times it becomes difficult when you want to give the real numbers, which, for example, when we speak about clinical officers, of the 14,000 clinical officers in service, 158 belong to the national government, and that is under my armpit.